So if I'm a patient with AML, what should I be watching out for in my daily life?
Well, I think the thing that I try to have patients and their caregivers, because it's really what I call a team sport, it's something that really requires a team, is to live and try to enjoy life as much as possible. Part of that is trying to be well, otherwise well, and that is difficult when you're faced with something like AML, acute myeloid leukemia. But we try to make sure that we are helping them to maintain all of the normal diet, nutrition, exercise, avoiding things that may adversely affect them, things like infection. But it doesn't mean you can't go out. It doesn't mean you can't be with your family. So living is important. I think the other really important thing is to try to understand your disease and try to help your caregivers understand the disease in terms of things that we need to know about quickly so that we can address them before they become more serious, things like infections. So we always try to help patients understand what I call reportable signs and symptoms, things that I need to know about and or someone needs to know about, even if it's midnight, so that we can mitigate or prevent that becoming more severe. And then lastly, really trying to maintain some level of hope for whatever that is. And even in the case of very severe or poor prognostic AML, identifying what your wishes are and being able to articulate those or talk about those to your team so that we can individualize the therapy for the patient based on what their wishes or their hopes are for their lives. And that's sometimes hard to learn how to talk about it, but increasingly the shared decision making or having those conversations with the patients and their caregivers are increasingly important so that we are tailoring that therapy for the individual patient.